Hello and welcome to my presentation. My name is Christelle and I will be sharing a summary and analysis of a peer-reviewed journal relating to maternal health, specifically severe maternal morbidity. As you may be aware, the United States is the only high-income country whose rate of pregnancy-related complications and deaths have increased over the years. This is known as the maternal health crisis, and there are racial disparities as to who is most impacted. To provide context, I am going to share a clip from a documentary called Aftershock. This documentary was responsible for bringing the maternal health crisis to the public's awareness when it was released in 2022. So you heard in the beginning of the clip that one of the mothers, Shamani, was experiencing heart problems just before she passed. Although we don't have the specific details, we can consider that a condition as part of the severe maternal morbidity. Severe maternal morbidity is any adverse health condition that a mother or pregnant person experiences as a result of their pregnancy. These complications can have short or long-term consequences to the health of the mother and sometimes the child. Severe morbidity is actually more common than maternal mortality. The most common complications include cardiovascular problems like heart attacks or heart failure, blood clots, hemorrhage or excessive bleeding, conditions related to high blood pressure, post-delivery infections, and kidney failure. So the title of the article that I will be reviewing are the determinants of severe maternal morbidity and its racial/ethnic disparities in New York City from 2008 to 2012. This study was done in partnership with Montclair State University and the New York City Department of Health and Mental Hygiene. In exploring severe maternal morbidity in NYC, the research focuses on understanding the complex dynamics between race, ethnicity, and socioeconomic factors in influencing severe morbidity. The primary aim was to quantify the risk factors associated with severe morbidity among different racial and ethnic groups, providing a clear picture of how these factors interplay. Additionally, by analyzing socioeconomic status, the study aimed to determine its role in modifying SMM risk across diverse populations. This is crucial given the persistence of racial disparities, even among the highest income educational groups. To summarize, the research probes how race and ethnicity shape severe morbidity risk, the socioeconomic circumstances that might modify this risk, and the search for additional explanations beyond simply income and education. The study leveraged a combined data set of birth certificates and hospital discharge records, using a CDC algorithm to identify severe mortality morbidity through 25 ICD codes indicators. This integration allows for a thorough assessment of contributing factors to severe morbidity. The researchers employed mixed effects logistics regression models to evaluate the risk of this condition across various demographic and socioeconomic factors, including educational attainment, maternal age, and poverty levels. This method allowed them to account for individual and community level characteristics that may influence maternal health outcomes. Stratified sampling was used to ensure that each group was adequately represented, and randomized sampling was utilized to minimize potential bias. Clinical data was extracted from electronic health records, supplemented by socio-demographic info and insights into personal healthcare experiences. This method's approach provides a more nuanced perspective on the factors contributing to the condition. The findings highlighted significant racial and ethnic disparities with a strong correlation to socioeconomic status. Latinas and Asian Pacific Islanders were notably impacted. Blood transfusions emerged as the predominant indicator, occurring at a rate of 176.5 per 10,000 deliveries, alongside complications during surgical procedures. Furthermore, between 2008 and 2009, NYC SMM ratio was nearly double the national average, with notable increases in cardio monitoring, sickle cell anemia crisis, and severe anesthesia complications. All racial and ethnic groups experience high SMM risk compared to white women, with Black non-Hispanic women facing the greatest risk. While socioeconomic factors slightly modify these disparities, they remain evident even among women of higher education and income levels, underscoring the complexity and persistence of these health disparities across different layers of society. Furthermore, certain factors contribute significantly to heightened SMM risk. Women aged 40 and above, those who had no prenatal care, experienced multiple births, or were obese, were vulnerable to SMM. Additionally, chronic conditions like diabetes, hypertension, or heart disease exaggerated these risks. In exploring the factors influencing severe morbidity, the authors of the study have pinpointed a critical gap in existing research. The interaction between socioeconomic conditions and race/ethnicity. Despite the general understanding of severe morbidity, risk factors, the nuanced role of socioeconomic status in modifying the influence of racial and ethnic backgrounds on severe mobility remains underinvestigated. This lack of exploration speaks to the necessity of the study. What's particularly concerning is that racial and ethnic disparities in SMM persist even in higher income and educational groups, emphasizing that other underlying factors may be at play. These persistent disparities suggest substantial implications for public health policies. By understanding this study, the authors aim to enlighten strategies that can address these inequities more effectively, tailoring interventions that consider both racial and socioeconomic dimensions to enhance maternal health outcomes. Using the mixed methods approach in this study is crucial because it combines quantitative analysis with a contextual examination of socioeconomic factors. By analyzing extensive birth and hospital discharge data, the study identified key demographic risk factors associated with SMM. Stratifying the findings by proxies of socioeconomic status, such as Medicaid enrollment, offers critical insights into how these factors may modify the relationship between severe morbidity and race/ethnicity. Furthermore, the study reveals that while racial disparities and severe morbidity are significant and persistent, they are exacerbated for certain groups, like Latinas and Asian Pacific Islanders, with lower income levels. This suggests that although higher socioeconomic standing does not eliminate racial/ethnic disparities, various socioeconomic factors can intensify them. Therefore, understanding these dynamics through mixed methods research isn't just important for accurate data interpretation, it's essential for informing policies. The study can be considered trustworthy because it examines a large data set from birth certificates collected from 2008 to 2012, offering a detailed analysis of severe morbidity risk factors across various demographics and socioeconomic statuses. This breadth of data is critical for capturing a representative picture of the underlying issues affecting maternal health. Mixed effects logistics regression models were employed, which are well capable of accounting for both fixed and random variables. This methodological rigor supports the study's conclusion about the risk factors and the modifying influences of socioeconomic factors on race/ethnicity. Such thorough analytical methods enhance the study's credibility in public health research. Lastly, the study acknowledges and documents persistent racial and ethnic disparities and severe morbidity despite adjustments for socioeconomic factors. This suggests that while socioeconomic status does influence health outcomes, there may be intrinsic racial and ethnic factors affecting severe morbidity. The study sought to understand how race, ethnicity, and socioeconomic factors influence maternal health outcomes. Using a comprehensive data set from 2008 to 2012, which included birth certificates and hospital records, the study found that maternal morbidity was impacted by a variety of factors. Despite improvements in some socioeconomic factors such as income and educational levels, racial and ethnic disparities and morbidity persist. This suggests that other unmeasured factors, including systematic healthcare inequalities and cultural barriers, may be at play. To address these entrenched disparities, public health policies must consider multifaceted strategies that go beyond economic and educational improvements, focusing on comprehensive support systems tailored for vulnerable populations.